first Autacoid that we're going to discuss is histamine. Histamine is an amine produced in a variety of animal tissues, as well as venoms, bacteria, and certain plants, particularly the stinging nettle. The amine, the histamine, is involved in inflammation. So the histamine is of course important during the process of inflammation. We also have the anaphylaxis. So when we say anaphylaxis, it is a form of allergic reaction that is considered to be severe, potentially life-threatening. Of course, we have allergies and certain types of drug reactions, and it also regulates gastric acid secretion. So this is a summary of the main functions of histamine. Again, it is involved in inflammatory reaction, anaphylaxis, allergies, and for example, when we are going to take in certain drugs, they can also cause certain drug reactions. And of course, it is also important in the regulation of the hydrochloric acid secretion from the stomach. Proceed to the synthesis and storage of histamine. So chemically, histamine is also known as beta-imidazole ethylamine, and it is synthesized from the decarboxylation of amino acid histidine by the enzyme histidine decarboxylase. So this enzyme, the histidine decarboxylase, is present in all cell types that contain histamine. And histamine is also widely distributed throughout mammalian tissues. For the storage of histamine, so it is generally accepted that most of histamine stored within the body is synthesized locally. So it is also important to note that the diethyric histamine and the histamine produced by the enteric bacteria are disposed of rapidly after absorption. So it does not it has a little contribution or no contribution to the tissue storage sites. In the animal body, histamine is found complex with heparin and protein in the granules of mast cells. So again, the mast cells are the major storage sites of histamine in the body. The catabolism of histamine. So again, there are two pathways whereby histamine is being catabolized. The first is via methylation, and it will yield the N-methylhistamine. And we also have the another pathway is through deamination, and it will yield the imidazole acetic acid. So the metabolites of histamine are pharmacologically inert and are excreted in the urine. So there are two major types of histamine stores in the body. We have the mast cell pool and the non-mast cell pool. So we'll start with the mast cell pool. Again, when we say mast cell, this is a type of white blood cell found in connective tissues all throughout the body, especially under the skin, near the blood vessels, the lymph vessels, and the other areas. So they are made up of mast cells in connective tissue and basophils in the blood. Whereas for the non-mast cell pool, they are made up of histaminocytes localized in the GIT, CNS, dermis, and other organs. In terms of the turnover of histamine in this mast cell pool, so the turnover of histamine in mast cell pool is considered to be slow, and for the non-mast cell pool, it is fast. So when we say turnover, that is the rate of replacement of histamine in this particular cell type. How about for the functions of the histamine in the mast cell pool? So the mast cell pool represents the histamine that participates in inflammatory responses, allergic phenomena, shock, some adverse drug reactions, and other forms of cellular insult. Whereas for the non-mast cell pool, now this histamine is synthesized and released continuously rather than being stored. The functions of this histamine are it serves as a neurotransmitter in the CNS, and for the GIT, it serves as control for the gastric secretion. In terms of the effect of histamine liberating drug, such as the 4880, complete emptying of the storage granules and release of histamine. So this is the effect of the 4880, the histamine liberating drug in the mast cell pool histamine. Whereas for the non-mast cell pool, this storage sites are considered to be resistant to histamine releasing drugs such as the 4880. There are four major types of histamine receptors in the body. and that have been described, no, and but we are only going to focus on the two major types of histamine receptors, the H1 and the H2 receptors. So again, for the histamine receptors, now these are considered to be GPCR, G protein coupled receptors, and they utilize G proteins in order to produce their uh, physiological effects. So we have here, the different histamine receptors. We have the H1, H2, and the H3. And also have here, the selective agonist of these receptors. So these agonists will again bind to the histamine receptors and to produce the effects that are that will mimic, the effects of histamine. So in the case of H1, we have 2-methylhistamine as its selective agonist, and in the case of H2, we have the 4-methylhistamine. In terms of the selective antagonist of the histamine receptor, so these are our antihistaminic drugs, our histamine H1 antihistamine, and we also have here our H2 antihistamine, or H2 antagonist or H1 antagonist drug. So in the case of H1 receptor or H1 histamine receptor, we have the chlorpheniramine as the prototype, selective antagonist for the H1 receptor. And an example of the selective antagonist for the H2 receptor is the ranitidine. For the distribution in the body and the actions that are mediated by the histamine receptors, so the H1 receptors are mainly distributed in the smooth muscles of the GIT, the respiratory tract, and the uterus. We also have the blood vessels, the afferent nerve endings, the ganglionic cell, the adrenal medulla, and the brain. So for example, when histamine will bind to the H1 receptor, what the histamine will does, or this particular type of receptor will mediate contraction of the GIT, respiratory tract, and the smooth muscle of the uterus. For the blood vessels, this particular receptor will mediate the vasodilation and increased capillary permeability of the endothelium of the blood vessels, particularly of the small blood vessels. For these smooth muscles of the blood vessels, so it will induce the vasoconstriction. Of course, this is true, for the large blood vessels. For the afferent nerve endings, the H1 receptor will mediate, for example, stimulation of the afferent nerve endings through the H1 receptor will produce itching and pain. For the ganglionic cells, so it will produce stimulation. For the adrenal medulla, so stimulation of the H1 receptor will induce release of catecholamines. So when we say catecholamines, this refers to our epinephrine and norepinephrine. So in the case of the brain, so again, the histamine is not only an autacoid, but it also is a neurotransmitter. How about for the H2 receptor? So the selective agonist of the H2 receptor is the 4-methylhistamine. So again, when we say selective agonist, this type of substance will mimic the action of histamine at H2 receptor. For the selective antagonist for the H1 antihistamine, or rather H2 antihistamine, we have the ranitidine. These are the distribution of the H2 receptors in the body. We have the gastric glands of the stomach, the blood vessels, the heart, and the brain. So, for example, when histamine will bind to the H2 receptors that are present in the gastric glands, what histamine will do is that it will produce, or that it will increase the gastric acid secretion. For the blood vessels, so it will basically produce dilatation. For the heart, so the H2 receptors that are present in the heart will mediate, for example, positive inotropy and positive chronotropy. So when we say positive inotropy, so when we say inotropy, that refers to the heart contraction. So when we say positive inotropy, there is an increase in the strength of the heart contraction. For the positive chronotropy, when we say chronotropy, that refers to heart rate. So positive chronotropy is an increase in heart rate, or increase in the heartbeat. No? So of course, when there is positive inotropy and positive chronotropy, what will be the end result will be an increase, of course, no, in the uh, an increase in the heart contraction, increase in the force or the myocardial contraction, increase in the cardiac output, and increase in the blood pressure. The H2 receptors also mediate, the neurotransmitter function of the histamine. These are the pathophysiological functions of the endogenous histamine. So we'll start with the action of the endogenous histamine in the stomach. So it will induce now the secretion of the hydrochloric acid in the stomach, and that is mediated via the H2 receptor. We also have the release, released from the mast cells following antigen-antibody interactions during hypersensitive reactions. And this is true during certain allergic reactions or anaphylactic reactions. We have the presence of the antigen. So, for example, the antigen could be the food allergens, the allergens from the food, or the allergens from the uh, insect stings or insect bites can serve as an allergen, and these allergens can stimulate, for example, the plasma cells to produce antibody, and the antibody will interact with the allergen, and also the antibody can bind, for example, to the mast cells, and these mast cells will release the histamine. And of course, this is under the type 1 hypersensitivity reaction. Of course, the histamine is not only an autocoid, but it is also a neurotransmitter in the CNS. And as a matter of fact, no, it is important for the regulation of water intake, body temperature, the release of the antidiuretic hormone, blood pressure, and pain perception. Histamine is also important because it regulates the GI tone and motility. It helps to maintain the normal peristalsis. Histamine is also released during extensive tissue damage. So when there is tissue damage, one of the major cell types that is being released is, of course, histamine. And histamine is very important because it mediates local circulatory response to injury, and, of course, it promotes inflammatory reactions. It also plays an essential role in the process of tissue growth and repair because these tissues contain high concentrations of histamine. There are three major factors that induces the release of histamine from the mast cells. And number one of that is tissue damage. So when there is tissue damage, for example, there is trauma, there are stings, venoms, or putylytic enzymes. So it can induce now the release of histamine. We also have the antigen-antibody reactions, and this involves now the IgE antibodies. So these antibodies, the IgE antibodies, are important, and it will attach to the mast cells. And during attachment in the mast cells, that is the time that the histamine stores in the mast cells will be released. We also have some drugs that are important for the release of histamine. So examples of this are morphine, atropine, polymyxin B, and others. These drugs, when taken in, have the tendency to release histamine without an immunological reaction. For the pharmacological effects of histamine, so in the blood vessels, it will cause marked dilatation of the smaller blood vessels, particularly the arteries, the arterioles, now the capillaries, and the venules. It has an opposite effect to the large blood vessels because it has now a constrictor effect on these tissues. For the histamine shock, so histamine shock will develop when there is intense dilatation of the capillary bed. So when there is the release of histamine in the body, so again, it will cause marked dilatation of the capillaries. So when there is intense dilatation of the capillaries, it will also result to the increase in the capillary permeability. So the dilated arterioles, capillaries, and venules that tag large volumes of blood and reduce venous return to the heart and thus the cardiac output. So When there is an increase in the permeability of the capillaries during the release of histamine, for example, during um, a severe allergy or anaphylaxis, what will happen is the blood that is present within the intravascular space or within the blood vessel will will be leaking towards the interstitial fluid. So this will result to a reduction in the venous return of the blood to the heart, and there will also be a reduction in the amount of blood that is being pumped by the heart, and it will result to a reduction in the cardiac output. So of course, this will be detrimental to the individual because a reduction in the cardiac output will also result to a reduction in the hemoglobin present in the body and a reduction in the tissue perfusion, for example, blood supply to the heart, blood supply to the GIT, to the stomach, blood supply to the skeletal muscle or in the brain. So this is not good to the body. So histamine release during allergic or anaphylactic reaction is an example of the cause of the histamine shock. So the condition may cause death due to vascular shock as seen in acute surgical or hemorrhagic shock. So of course, during hemorrhagic shock, it is a condition of reduced tissue perfusion. So again, when we say reduced tissue perfusion, this results in the inadequate delivery of oxygen and nutrients that are necessary for cellular function. So this diagram shows the cascade of events that happens during a stab wound or when there is an injury in the skin. So how does the body react to a stab wound? Damaged cells. So basically, when there is a stab wound or a splinter in the skin, so what will happen is now the damaged tissues will what it will do is the damaged tissues will attract mast cells, and the mast cells will release histamine, which diffuses into the blood vessel. So this is our mast cells, and it will be attracted to the site of the damaged tissue, and it will release this what we call histamine. After that, histamine will cause the vessels to dilate and become leaky, and we also have the complement proteins leave the vessels. So in this picture here, we have here the released histamine, and as you can see here, we have here the blood vessels. So the blood vessels become dilated, and it later on becomes leaky. These are the blood capillaries. So the for example, the blood plasma and the phagocytes will move into the infected tissue from the vessels. So from the blood vessel, the phagocytes that are present here will move towards the infected tissue. And after that, the phagocytes will engulf the bacteria and the dead cells that are present in the damaged tissue. The histamine complement signaling will cease. So after the phagocytes have already engulfed the bacteria and the dead cells, and the complement proteins have acted on this infected tissues, after some time, the histamine and complement signaling will cease, and the phagocytes are no longer attracted because histamine is not present. So the growth factors from the white blood cells and the platelets will simulate the cell division and the skin cells healing the wound. Another pharmacological effects of histamine is this what we call triple response. So for example, when histamine will be injected intradermally, so there will be this what we call triple response, and it is again produced during the intradermal injection. So this triple response includes a localized red spot. So the presence of the localized red spot is due to the intense capillary dilatation, developing within a few seconds and attaining maximum U within a minute. So again, the major function of histamine is that it will cause the small blood vessels to be dilated, and it will also cause it to be leaky. So when there is a capillary dilatation, it can induce a localized red spot in the skin near the site of intradermal injection. We also have the wheal. So when we say wheal, that is a localized edema fluid that occurs in about 90 seconds after the intradermal injection, and this is due to the exudation of fluid from the capillaries and venues. So again, this is due to the capillaries now being leaky and the fluid now coming out from the blood vessel. We also have the flare. So when we say flare, that is diffuse redness in the surrounding area due to the arteriolar dilatation mediated by axonal reflex. So this is also due to the marked dilatation of the small blood vessels. So this is the characteristic triple response as described by Lewis. So the triple response is caused by a firm stroking of the skin with a pointed object. So the three components under this are the presence of the red spot. So the red spot here is caused by the capillary vasodilatation. And after the development of the red spot, there will be the presence of the flare. So again, flare is redness in the surrounding area due to the arteriolar dilatation. The third part of the triple response of Lewis is the wheal. Again, the wheal is caused by the exudation of the extracellular fluid from capillaries and venules. So these are the other pharmacological effects of histamine in the non-vascular smooth muscles. So in the bronchi, it can induce acute bronchial constriction via H1 receptors in most species, with some exceptions such as the guinea pigs. So the guinea pigs are exceptionally sensitive to, and even minute doses of histamine can evoke bronchoconstriction leading to death. We also have tracheal relaxation in cats, bronchial relaxation in sheep, and uterine relaxation in rats, but uterus is generally contracted in other species. For the exocrine glands, so again, there is increase in the gastric acid secretion via the H2 receptors. For the sensory nerve endings, histamine will induce itching and pain. Autonomic ganglia and the adrenal medulla, so it will induce the release of adrenaline. And of course, adrenaline is a pressure agent. It will increase the blood pressure. For the CNS, so histamine does not readily penetrate the blood-brain barrier.